What's scarier, a robot holding a scalpel or a human making a mistake during surgery? The robot might actually save your life. Today, we're diving into the fascinating world of robotic-assisted heart surgeries, where precision meets cutting-edge tech. And trust me, it's not science fiction anymore, it's science fact. Let's get serious for a moment. Did you know that heart disease is the leading cause of death worldwide? Over 17.9 million people die each year from cardiovascular issues. And while traditional heart surgeries save lives, they come with challenges, long recovery times, higher risks of infection, and the dreaded possibility of human error. But here's the good news, technology has a solution. Enter robotic-assisted heart surgeries, where machines enhance precision and minimize risks. Sounds cool, right? But how does it actually work, and is it really better than what we already have? I will present the discussion in 3 key segments. Don't go anywhere, we're just getting started, and the best is yet to come. Segment 1. What is robotic-assisted surgery? Robotic-assisted surgeries aren't just about robots taking over operating rooms like it's a sci-fi movie. They are about giving surgeons superhuman abilities. These systems, like the Da Vinci surgical system, allow doctors to perform complex procedures through tiny incisions with incredible accuracy. Think of it as a surgeon controlling a video game console, but instead of scoring points, they are saving lives. Fun fact, the first robotic heart surgery was performed in 2001. And since then, over 1.5 million robotic procedures have been performed globally. But let's get into the specifics. What makes it better? Segment 2. Advantages of robotic-assisted heart surgeries. First up, precision. A robotic arm doesn't tremble. It doesn't get tired after hours of surgery. Surgeons use these systems to operate with millimeter accuracy, which is a big deal when you're working on something as delicate as their heart. Second, minimal invasiveness. Unlike traditional open heart surgeries, robotic-assisted procedures often require only small incisions. This means less scarring, lower risk of infection, and faster recovery times. Patients are back to their normal lives sooner, sometimes within weeks instead of months. Third, accessibility. With robots assisting, surgeons can perform complex surgeries that might not be possible otherwise, especially in smaller hospitals or regions with limited access to specialized care. Segment 3. Challenges and limitations. But let's not pretend everything's perfect. Robotic surgery isn't without its challenges. For one, these systems are incredibly expensive, often costing millions of dollars. That cost can trickle down to patients, making the procedures less accessible in some places. There's also a steep learning curve. Surgeons need extensive training to use these systems effectively. And, of course, there's always the question, what if the technology fails? The truth is, no system, robotic or human, is completely foolproof. However, the potential benefits far outweigh these challenges. In fact, studies show that robotic-assisted heart surgeries have lower complication rates and shorter hospital stays compared to traditional methods. So, while it's not perfect, it's a step in the right direction. Segment 4. Real-world success stories. Let's talk about real-world impact. Hospitals worldwide are already adopting this technology. For example, Cleveland Clinic, a leader in robotic heart surgery, has reported outstanding success rates. One patient, a 55-year-old man, underwent a robotic mitral valve repair and was back on his feet within 2 weeks. And it's not just the US leading the charge. Countries like India and Germany are making strides in robotic-assisted surgeries, making it more accessible globally. It's clear that this isn't just a futuristic concept, it's happening now. And it's saving lives. So, what's the takeaway? Robotic-assisted heart surgeries are revolutionizing healthcare. They are not here to replace surgeons but to empower them, offering greater precision, faster recovery times, and a safer experience for patients. But this is just the beginning. As technology advances, we could see even more breakthroughs, maybe even fully autonomous robotic surgeries someday. What do you think? Would you trust a robot to perform surgery on you? Let me know in the comments. Well done on completing our exploration of how robots are transforming heart surgery. This is just the beginning of understanding how technology is reshaping healthcare. So stay tuned for even more insights and innovations ahead. If you enjoyed this deep dive into the future of medicine, don't forget to subscribe and hit the notification bell. Watch my next video on the uses of ChatGPT-like AI models in medical education. Don't miss it. Thank you for watching, and I'll see you in the next episode of Tech Med Talks.